Hello, dear friends. It's good to be with you again. Today I'll be talking about another exciting topic titled Fibroids in Pregnancy. I know a lot of people, when you hear the word fibroids, which we technically refer to as leiomyoma, they really go gaga. They're really upset about it. But I want you to understand that 1 in 4 women, in some cases, 1 in 3 women of the reproductive age range have fibroids. But the good news is that many of them, the fibroids don't give sufficient enough symptoms for us to intervene. So as OBGYNs, we don't go after every fibroid. We only go after fibroids that are troubling the woman. So that is reassuring. But in some cases, some women get pregnant and they have a fibroid in them. As a matter of fact, I think the statistic puts that 1 in 7 or 1 in 8 pregnant black women who have fibroids coexisting with pregnancy. So how do they cope with that? Now, in many instances, the top challenge that the women that have fibroid in pregnancy will have to cope with is that of pain. There's a terminology, there's a term we call regeneration of fibroid. It's a complication of fibroid in pregnancy that's associated with so much pain, particularly in the late first trimester and the early second trimester. The pain could be so distressing and discomforting that it may necessitate admission and treatment with pain relief and fluid therapy. We have to do that in times, but many times the women will do well with oral analgesics, oral pain relief drugs that they take at home, and a lot of bed rests. We also worry when fibroid associated with pregnancy is making the woman to spot, to bleed while she's pregnant. In that case, the fibroid is eliciting a threatening miscarriage. That could be very disturbing. Many times what we also do is to reassure the women, put them on bed rest, give them fluid and wait it out. In many cases, it will resolve and stop and they will continue the pregnancy. In some cases, it may lead to an inevitable miscarriage, and that is really disappointing for many women. So what's the point? In most cases, women will not know when they have fibroid coexisting with pregnancy. At times they may know, but in most cases they won't know. The first time they may notice is when they start having pains in early pregnancy, probably late first trimester or second trimester. Then when you do an ultrasound scan, you discover that there's a fibroid coexisting with that pregnancy. You begin to plan interventions or plan reassurance for them and just watch how things will evolve. So if you're pregnant and your doctor is telling you that you have fibroid coexisting with your pregnancy, or you're having symptoms that made them to realize that you have fibroid coexisting with pregnancy, do not be so alarmed. Whenever you have pain associated with this condition, you have to present to your caregivers. They will give you pain relief, they will counsel you and see how they can help you to tide it over. By the time most women get to the 3rd trimester, most symptoms would have abated and they will be fine, they will progress and deliver subsequently. In some cases, symptoms may persist and may lead to early labor, so what we call premature labor, and the baby may come earlier than planned. And so babies will need support in a special care baby unit. In rare instances, fibroid may be located in a situation where it's so difficult for the woman to deliver naturally, and cesarean section will become an option for them to deliver. But that is very, very rare. Most cases, we will not do cesarean section for a woman because she has fibroid. Very, very unlikely for that to happen. Extremely unlikely. Only very rare instances where we know that there's no other way the baby can progress through the birth canal because the fibroid has completely obliterated or blocked the birth canal, then C-section becomes an option. Now, when we do C-section for women who have fibroid coexisting with pregnancy, we try not to trouble the fibroids. We just take out the baby quietly and we'll plan for the fibroid later on. We have to fight another day. So take care until we meet again next time. Bye.